Well, welcome back to the morning show. October is Breast Cancer Awareness Month.
Other than skin cancer, breast cancer is the most common cancer among American women. Katie Sheilding with Christie Clinic joins us over video chat to share how we can detect the early signs. Good morning, Katie. How you doing?
Good morning. Thanks for having me on your show.
Thanks for being here. So first and foremost, obviously, there's a whole month dedicated to breast cancer awareness. Why is it so important that we have this conversation?
So the earlier a lesion is detected, the better chance that we have to make a significant difference in their treatment and decreasing the risk of metastatic disease. So the better we can help women.
And Katie, can you talk to us about the importance of early detection and when that process should start, I guess?
Absolutely. So I encourage women over the age of 18 to become familiar with their breast tissue. So that way, should any changes occur, they would be the first to know, and then to have a healthy relationship with their healthcare provider so that the healthcare provider can advocate for them in what next steps needs to happen. So if they detect any abnormality.
So, Katie, that does include self-exams, correct?
It does. So we recommend clinical breast exams once a year. So that would be performed by a healthcare provider. And then we recommend monthly self-breast exams by the patient. And typically I recommend that they do that the week after their period. So not the week before or the week of their menstrual cycle, but the week after, in the shower with some soap, looking for any type of change in the breast.
When it comes to mammograms, is there a specific age where women need to start going and seeing their doctor about that?
So I think it's important for them to discuss that with their healthcare provider, because depending on their medical history, their family history, that screening recommendation may change. So some organizations recommend that to be done at 40, others recommend it at 50, some recommend it yearly, some recommend it every other year. So I think that's a decision that should be made between the patient and her healthcare provider, reviewing her medical history as well as family history.
And with the coronavirus pandemic, I know when all of this first started, a lot of people were waiting to go to the doctor, specifically for the mammogram itself.
Sure.
Why is that so important not to delay that?
Yeah, the longer that a lesion is left without management, the higher risk there is for metastatic disease. And we've taken tremendous precautions to make sure that patients are safe in our facility for their appointment with their healthcare provider, as well as for their imaging or mammograms, including extensive screening and cleaning, temperature checks, spacing out of appointments, social distancing, wearing masks. So we've gone to great lengths to try to help keep our patients safe.
And Katie, can you tell us what kind of feeling it is to hear a breast cancer survivor story after early detection? You know, what kind of reaction is that to hear them share their feedback as well?
Absolutely. So what I tell my patients is I'll stop recommending mammograms when we stop finding breast cancer on mammograms. So I have had numerous patients who had no signs or symptoms whatsoever, and it was only detected with a mammogram, and then at a much earlier state than when she would have found it or I would have found it on exam. So I strongly recommend patients discuss that with their healthcare provider to find out when is best for them to start.
Do you have that early detection rate and how much it can save your life?
I don't have that on hand, but I will say, I have had patients who are good about doing their self-breast exams. They come in for a clinical breast exam and nothing was detected, but then they went and had even just some microcalcifications, which can sometimes be the earliest state of development. And we were able to manage that very, very well and actually conserve quite a bit of her breast tissue without radical surgery, which was pleasing to the patient, obviously.
Absolutely. Now, Katie, we always talk about how October is Breast Cancer Awareness Month, but can you tell us why this is something that's important to talk about and discuss with your doctor throughout the year, not just October?
Absolutely. So I know we focus on it in October, and our radiology department is very busy in October because everybody's good at getting in on those screenings. But it does happen all year long, and so we do want them watching for changes that they may notice or that their partner may notice, which would be like nipple tenderness, change in the breast tissue or texture, any unexplained change in size, whether that's swelling or shrinkage, warmth, redness, tenderness, any change in the nipple, whether that would be a new onset inversion or tilting of the nipple, any type of nipple discharge in a non-breastfeeding woman would need to be evaluated. And honestly, most lumps end up being non-cancerous, but all lumps should be evaluated. So any change whatsoever needs to be investigated by your healthcare provider.
So obviously, Katie, us having this conversation with you is extremely important for education for some women. Why is that conversation, that open dialogue with your doctor, just extremely important for your own knowledge?
Yeah, so I think patients want to advocate for themselves, and I tell my patients it's important for me to have the knowledge, but they live with their body 24 hours a day, 7 days a week, 365 days a year. And so sometimes they'll put off those small changes thinking that they're nothing or that they're going to go away, and then wait. And sometimes even fear will cause them to procrastinate getting that screening and that early detection. And so it's really important all year long to have that education and for women to feel comfortable talking to each other about those changes. And it's not something to be silent or ashamed of.
And Katie, what resources are available at Christie Clinic if somebody needs to reach out to you and have, questions that they would like to have answered about this?
Absolutely. They're welcome to call our department at 217-366-1255 to get associated with one of our OBGYNs. And then we will refer from there depending on a case-by-case basis as to what we need to do next.
Good thing to talk about this morning. Thanks so much, Katie, for your time.
Thank you as well.
Well, Jack has your forecast next. We'll be right back.